A very good evening to everybody watching. Thank you for joining us tonight on the evening review. My name is Toiwan Jabela. Tonight on the platform we are joined by Agapitus Hausiku. He is the director of OurRight Namibia, an organization that commented quite extensively this week on the issue of distribution of condoms, or lack thereof, in prisons across the country. Thank you very much, Agapitus, for making time. It was a very interesting debate because OurRight Namibia commented, and a few other people, including, I think, prison chiefs and police. I know what your stance is, but for those who missed out on your pronouncement in the paper, what is your position on the matter?
Yeah, no, the position on the matter from our side is guided by some health protocols, including the National Strategic Framework on HIV/AIDS as to the epidemic context for Namibia.
Yeah.
I mean, you know, Namibia is one of the highest countries in terms of HIV infection. So with a small population like ours, the country has identified key areas that they are supposed to focus on with regard to prevention and treatment of those that are affected. And then you speaking about in terms of the National Strategic Framework on HIV and AIDS. So we have key populations, and people that are incarcerated settings like prisons are also part of key populations. And these are groups that are vulnerable, that are discriminated and stigmatized against, and they have difficulties accessing healthcare services compared to the general population. And as per this framework, it's indicated that people that are identified as key populations are high in terms of acquiring HIV/AIDS compared to the general population. And something needs to be done regarding that. So there are clear guidelines from the Ministry of Health in terms of the National Strategic Frame on HIV/AIDS as to what needs to be done. And it's from that understanding that the argument is put forward. Yeah.
So you are in support of distributing condoms in jails, in prisons, basically?
Yeah, no, we actually as an organization is guided by those factors, because in terms of intervention, so there must be parameter that guides you as to what it is that you are supposed to do in order to minimize infection. So in the general public, due to all these contexts that you have available, so you are guided as to what needs to be done. So incarcerated setting individuals, it's not, because some people are arguing, no, if you're distributing condoms in prison, so you're promoting sexual activities within this setting. So are we promoting? Because currently it's already happening without the distribution of condoms. But the individual who is in an incarcerated setting has the same right in terms of accessing healthcare services as you. Because in as much as I'm in prison, if I am sick, I need to be treated. But then if there are mechanisms to prevent so that I don't get infected, so those mechanisms needs to be applicable to everybody.
Yeah. Now, I think the difficulty, Agapitus, here is that sex is outlawed in those facilities, generally. That is already the standard to say you may not, I don't know, maybe it's not, I don't think if people are found indulging in those acts, they will necessarily be punished. But I think that the general acceptance is that sex is not really supposed to take place. But like you said now, it still takes place. Now, if something is not expected to take place, when I put that packet of, that box of condoms there, what am I saying to those that are in the facility?
What you're saying to the people in the facility is protection, because the argument is not only in Namibia, it's a worldwide something. Even in the United States, it's the same discussion. So the distribution of condom in those facilities becomes a challenge too. But then if you look at countries where condoms are distributed in prison, like in the UKs and other Western European countries, even in Africa, South Africa and Lesotho is doing it. Where this distribution is happening, the infection rate in incarcerated setting has reduced to 50% compared to the current situation. So nobody is saying sexual activities need to be encouraged there, but people are doing it anyway there. So once information, because there is information in terms of people are like, no, you need to educate them in terms of not doing it like we say, but then the people are still doing it. So you need to go further than that in terms of providing some protective mechanisms. So that in the event the person is doing it, what is it that I need to do so that I am? Because it's not only HIV, there are also other STIs that a person can acquire if you are indulged in any unprotected sexual activities. So you are looking at it from that angle. So we understand the moral position, because that becomes always a challenge. We're looking at it from a moral point of view, like we say, is it a promotion? It's not necessarily a promotion.
Yeah.
It is actually a preventative mechanisms that you are doing to ensure that people are necessarily not infected as a result of us not putting measures in place that will ensure the safety of the individual who happens to find themselves in a situation of that nature. Yeah.
I mean, one of the issues that was raised in the article in which you commented in the Namibian was about the incidences of rape.
Yeah.
Where the weaker men are bullied inside those cells, sometimes sexually.
Yeah.
And people are saying if there are no condoms, maybe these bullies will not be, some of them might not be tempted to go ahead and force themselves onto these perceived weaker men. But once you say condoms are there now, the message to them might be that, okay, now.
No, you know, the whole issues of condom distribution, Trevor, it's not just put there. There is an education process that needs to happen. The prison officials are not qualified individuals to do that. You have organizations like OurRight Namibia. You have a lot of other organizations in this country. The Ministry of Health is sitting with that capacity to do that. So they have trained officials that are able to engage and work with prison officials regarding that matter, so that the right information is communicated to the people in terms of using. Because it's not saying condoms are put there, then it means if I need to do it, I just have to pick it. So we first speak into you as an individual in terms of protecting yourself. Whether you are seeing yourself in this prison setting as the stronger person who's supposed to dominate everybody to do whatever it is that you feel like doing, how are you protecting yourself in terms of your health situation? And if this is because if you are in a position where you think, no, I'm dominant, I'm more powerful to do that, you are able to do it with multiple individuals. Not only are you putting the others at risk, but you are also putting yourself at risk. So what are you doing in terms of protecting yourself? Yeah.
Let's look at it, Agapitus, from our domestic setups. Let's assume that you have children at home who are about to reach the age of sexual activities, physical sexual activities.
Yeah.
Maybe your son is 13 years old.
Yeah.
Generally, you don't expect that he is sexually active. But once you give him condoms now, because of course you're a parent, because you don't know when he will start. He's a parent, and you just want to be cautious.
Yeah.
If you say, son, here is a packet of condoms now, what are you saying to him?
No, you are not saying to him to indulge into any sexual activities. You are saying to him that if you happen to do that, you must be responsible, because there are risks for you to do it unprotected. So you're becoming a responsible parent, because the child will be, because giving the child the condom doesn't mean there is any sexual partner that is readily available for that specific child. But you are instilling a message in the child to say it's a risk for you to do it without protection. And it's also an issue of you preventing the child, especially if it is a girl, from unwanted teenage pregnancy. So that she is able to know the moment I do it with any other person without protection, I get STI, I get HIV/AIDS, I can also fall pregnant. So it's unwanted teenage pregnancy. As for a parent, that discussion is key around protecting young people. Because even in Namibia now, The highest infection rate is happening in the age group between 14 to 24-year-old girls. So these are young girls that are vulnerable. There are a lot of issues that create this vulnerability for these young people to indulge into this kind of sexual activities. But the lack of education make it worse.
Yeah.
Because if this young person is educated, they understand as to how to negotiate around it, they will be in a position to request that the person that they are engaged with. Because if you look at these young girls or young boys that's been exposed to all these programs, they are articulate and in a position to protect themselves when it comes to engaging in unprotected sexual activities, compared to somebody that you have never exposed to this.
Yeah. When a guy, an inmate who is straight, heterosexual or whatever, of course we've seen incidences of men who go in jail as straight men, as they call themselves, straight men.
Yeah.
Then they will indulge in sex with other men, and when they're asked, I remember one interview when the guy was asked, "Are you now gay now?" He said, "No, I'm not gay." So I can also understand that it's not limited necessarily to people who perceive themselves as gay.
Yeah.
But if you are just a straight man, you just want to serve your term, you accepted your fate, and you see prison authorities distributing condoms in your cells there, I mean, that must be scary, just seeing that.
No, I mean, it's not the first time that you are seeing a condom. You're coming from the outside where condoms are all over. So you get them in service station. The only church that I think that doesn't distribute it at their facility is the Catholic Church. If you go to an else in health facility, condoms are there, their facility and so on. So they are all over. So it's not like it is the first time that this individual will be able to see a condom. So maybe what one can look at is, has this person experienced people having sex in prison? How is that compared to him seeing a condom?
Yeah.
Because if he's able to see these two male engage in a sexual act in prison, isn't he supposed to think about their protection and safety? Because if he's able to see it, I believe a lot of these individuals in incarcerated setting are exposed to all this happening. So what are their thoughts around the health situations of individuals doing that? So if you see a condom, it's because I have seen other people in prison doing it. So it is for them. If me as an individual who's like, no, I don't want to do it, it's okay for you. But those individuals that are indulge in that. And also another thing, Toivo, indulging in sexual activity or having sexual intercourse with another man doesn't make you gay. So gay is broader than that. Being gay means you need to go beyond that. Gayness is somebody that is sexually, romantically attracted to somebody of the same sex, not just the sex. So the sex that is happening in prison is not homosexual sex. It's just sex between two males. So homosexuality is broader than that, and it's deeper than that. It is not only the sexual activity. So that individual in prison doing it might come out of there and continue his heterosexual life outside. So that means he gets into prison, get engaged into such sexual activity. When he's outside, he's looking for a woman to marry, or he left a girlfriend outside. Now what is happening? So he has gotten infected in prison, and now he's bringing it to the wife outside. And it's the same dynamic even outside when it comes to female sex workers. We are saying, who are their clients? It's married men. Married men or unmarried men that goes and pick up these female sex workers. And if there is no protection, that married man is bringing it to the wife. And you are continuing the cycle of infection. And that is actually where we are saying there must be a preventative mechanism, because to say no, they will not do sex. So the prison officials are not sleeping in the cells with the prisoners. They are outside here. The cells are far away there. So they only come at a certain time when they have to take them out, or coming at a certain time when they are taking them out to go have breakfast, or whatever it is that they are having. That is the only time of engagement. But other than that, these people are left in an enclosed setting by themselves, what's happening there is only seen a day after. So you can't say no, even if you put a camera there, how many cameras don't we have? But then criminal, even at your house, you might have CCTV and people still break in. And now we are saying, put a camera so that you are able to monitor. So prison officials are not there sitting to monitor the sexual activities that might happen. So they have other responsibility.
You rewind the tape later.
Even if you rewind, the activities had happened. The issue is about prevention.
I hear you.
Yeah.
We go for a very short break and return with Agapitus Hausiku. Our conversation with Agapitus Hausiku, the director of OurRight Namibia, continues on the evening review. Now, we have also the issue of the laws now, Agapitus, when it comes to, you saw a lot of judgments that came out of court in recent years, about same-sex. Of course, that is more to do with marriages. Then there was that landmark ruling about sodomy, I think. It was actually in favor of Mr. Dausab, who brought the case. So sexual activities, just to be clear, sexual activities between men, whether it's inside of jail or outside, as the law stands, it's not illegal. It's not a transgression of any law.
No, the ruling, like you're saying, that was in favor of Mr. Dausab, so that decriminalized sodomy. So, but then the government appealed.
Yeah.
So we're still waiting for the final ruling from the Supreme Court. So as it stands currently, while we are waiting for the final ruling from the Supreme Court, so it is still that legality component around it. But the basis of that was on the Constitution, in terms of your dignity as an individual and equality before the law for everybody. So that is actually the basis around it, and that is actually why the ruling was made on the basis that it was made.
So when something like that happened, in that sequence, Mr. Dausab goes to court, he wins the case, the state appeals.
Yeah.
So what is applicable now? Do you say the ruling stands, people must do things in accordance with the ruling now? Or do you say, pending the Supreme Court ruling, that act remains?
Yeah, pending the Supreme Court ruling, that act remains. So pending the Supreme Court ruling, so the act remains.
Meaning, okay. So it remains essentially a criminal offense as per the act.
Yes.
That is exactly why I'm saying that
the legality component around it. No, I spoke about those components from the beginning, the issues of morality, the legal position around the issues, and the complications around all these matters, not only for Namibia, but for other countries.
Yeah, but that's what I'm saying now.
But then Toivo, when you're looking around health-related issues, legal is something that me and you are making up. So it's Parliament that passes this law.
Yes.
So, but then when it comes to HIV infection, so it doesn't care about the legal position. But you as a country need to institute measures that will ensure that your citizen and your population is protected.
Yeah.
So you can't now say, no, just because we have this law that speaks to this, people must just die. You made that law. Why are people supposed to die on a law that you made?
I get that.
So it's not natural.
I get that.
Yeah.
But if you start distributing condoms in jail, you are becoming a catalyst and a facilitator of an activity that the law says is actually illegal.
So the law says an activity is illegal, but the Constitution is clear around it. The dignity of the person needs to be protected. That person must have access to health facility like everybody else. So there is also another position. So what are we saying? The Constitution is supreme.
Don't have
and
sex.
That is because that you are prolonging it as a government, violating your own constitution. So your own constitution is clear. It has simplified everything for you. All that you need to do is enact. Currently, under the law, sexual activities are still happening in prison, irregardless. But then there is an element of privacy if you are taking it outside. So because my space is my space, I don't want you to get into my space. What I do in my private capacity is up to, because I don't get into your space. What gives somebody a right and a position to think I can get into another person's space to decide as to what that person is doing. But here we are talking in terms of a prison context when a public opinion is supposed to matter. But then the health of the individual within that setting needs to be taken into consideration.
So somebody commented in that very news article also, I can't remember who said, I think it was Sharonese Bush, who said that prison by its very design is also meant to take away some privileges from those that are incarcerated and charged for criminal activities. So sex can't be one of those privileges that you enjoy.
There is no privilege with regard, it's a coercive situation that is happening. So nobody is saying the prisoners are given the right to have sex. I don't know where that is coming on. So the privilege is already removed from you by the mere fact that you are incarcerated. So nobody says people in prison, one of the privileges they are supposed to have. So we saying having the condoms there doesn't mean we are giving them the privilege to have sex. The activity is already happening irregardless.
You see,
so it is not a privilege. It's like saying, why are you giving them food? Why are you giving them water?
You see,
you are spending a lot of money on food and water. So if it's about privileges, remove everything. Let them starve, because you are saying you are punishing these individuals.
Yeah, but that line of argument, Agapitus, is the same as saying crime happens. It's not supposed to happen, but it's happening. And therefore, okay, then you can add to your argument, but your basis is that no, crime is already happening, so we can't do this or that, because whether we do this or not, crime will still happen.
No, it's unrelated. This is a health right issue. Crime is completely an individual deciding, I'm going to do that. But then when it comes to health, so it needs to be in a position where you as an individual is aided to make decisions with regard to your health rights. So you are supposed to be in a position where you are accessing services without discrimination. It's about your health right. You're not committing any crime. You're not stealing anybody's thing. So we're saying, no, this individual is incarcerated, he's in prison, but what other rights are there? Because the risk with regard to indulging. So people are indulging in sexual activities within this setting. And it's not only happening in Namibia, it's a worldwide thing, like I said at the beginning. But then what we're saying based on study and research from WHO and UNAIDS, countries that are doing it have reduced infections in this setting. Another thing that we are supposed to get from the correctional services is statistic. The information is not coming in terms of infections within this setting. People that are coming in, when they are out, what is their health status? Not that we need to know the individual who's coming out positive, just numbers, to really understand and have an idea around as to what. Because these people are getting back into society. How are they coming back into society?
Do you think, therefore, that because the way I see it now is that there's a structural issue there. And the structural issue here is the law right now that has been appealed in the Supreme Court. So if I'm a prison administrator, my duty, I've sworn to be faithful to the Constitution you are arguing, of course.
The Constitution guarantees you those rights. I don't know you sworn to what.
To uphold the law.
But you know, also the sodomy law is not an the Constitution makes provision that all laws before independence still need to continue until they are repealed. These are apartheid colonial laws. Even Britain that brought this sodomy law has repealed those laws. A lot of countries had repealed them. And if you look at the sodomy law, it is only British colonies. You don't have sodomy law in Angola. You do not have them in Mozambique. You don't have them in French-speaking countries. It is just British colonies that have sodomy law. So we happen to have the sodomy law because of the Dutch statutes that we adopted from South Africa.
Yeah.
So if we were another colony, we would not have, because if you have to go to Ivory Coast and Senegal, they don't have sodomy law.
Yeah.
They do not have these issues.
That's why I'm saying.
So these are colonial laws. So we are an independent nation.
Yeah.
In terms of protecting the dignity of individual, there is the constitution that was written by our own people.
Yeah.
It's guiding us.
Yeah, that's why I'm talking about structural issues now.
Yeah.
That it's not the prison authorities' fault, really, while there is that law. If you, Mr. Hausiku, were Mr. Raphael Hamnyela, who's Commissioner General of Prisons, if you were in his position today and you are a fierce advocate of distributing condoms in jail today as you do now, you would still not distribute them.
No,
because of that law.
It is not supposed to be his issue. We have a Ministry of Health whose responsibility is public health management. In their own frameworks, their guidelines with regard to these issues. Why are they not collaborating with them? Then they are supposed to guide, because now they are playing the role of healthcare workers or healthcare managers at prisons. So that is actually not their role. When it comes to health-related issues, so the Ministry of Health has a mandate to deal with those issues. And there are protocols and guidelines from the ministry as to how they are supposed to deal with that.
Yeah, no, I get that. I'm just saying that
because the Act, the Public Health Act, clearly says everybody have access, irregardless whether you are. I believe there is a component that speaks to people that are incarcerated and how they are supposed to deal with that. Suppose somebody is in jail who's HIV positive, let's say that, hypothetically speaking, and this person is there and nobody knows. How are you putting the rest of the inmates at risk?
Yeah.
Everybody is at risk within that cell.
No, people shouldn't have sex there. They are not the...
So it is actually, in terms of the individual, the individual having sex, that is your own individual prerogative. Apart from the coercive nature happening. So when you are forced, it's against your will to do it. Of course, that's another different element. But that person that is perpetuating that act is taking an individual conscious decision to do so.
I understand that.
Yeah.
Maybe in the final few minutes that we have left, talk to me about, I don't know if your organization ventures into, because you spoke about sex workers earlier on.
Yeah.
Do you do any work, advocacy work around that industry? I'm asking because there's also that huge debate now in the country to say, should we legalize prostitution, as they want to call it, as some call it, sex work?
Yeah.
And some say, no, that would be the end of us as a society.
As a society, we are so morally entangled that we are so scared of a lot of things that we don't even understand. So let's talk about the sex work component. Legalizing it doesn't mean everybody is free flow going to do it. Yeah. What you're saying in terms of legalizing it, that the individuals that are involved into this act are given the position to practice it without any discrimination, without any stigmatization or harassment. Because currently, whoever it is that is doing it is harassed as a result of you engaging in an activity of this nature. Some people might stand and say, no, it's okay, because morally it is not something that we are accepting. But in every activity of this nature, so there are actually guides as to how, because we are also not saying, then you must now go everywhere and stand in any position and do it. There's public decency and all that. So all that is being said is like individuals that are involved in activities of this nature, they are human beings like anybody else. They have the same rights as you and me. The issue of harassing this individual without necessarily understanding. I remember we had some discussions with parliamentarians in Swakopmund, and they were asking some of the sex workers that were there on the panel, like, if I gave you $1 million, will you still continue? The person is like, I'll still continue because I'm making more money doing this trade than the money that you are promising to give me. And I know you will not be able to raise $1 million for me to have it. So I'm supporting my family and. So there are all these things that these people are looking at. So for us as an organization, we do work with everybody. We work with men, we have sex with men, people who are incarcerated setting. We work with female sex workers, the transgender community. The whole idea is this group is classified as key population. And like I said from the beginning, key populations are vulnerable groups who are easily infected by HIV due to all these other issues and elements that we have spoken about. And they are unable to access healthcare facilities compared to you and me. So you and me can go into a clinic, see a doctor, see a nurse, and we get treated. But a female sex worker who's having an infection needs to explain to that sex worker who's having the same moral judgment like the rest of the society. So it is not easy for them. So that's why these organizations are there to really make sure, because there is the interlink between all these individuals and the general public. I said a female sex worker, the clients that they are engaged with are general men. These are married men, these are working men. And also, sex work is not only standing in the street. Sex work, you get professional ones.
Yeah.
And who is supporting it? These are married men, these are supporting these activities. So, and we happen to see and come across a lot of these activities happening. And also the understanding, the issues like we said at the beginning, homosexuality, who is a gay or a lesbian individual. A lot of the men that are engaged in same-sex sexual relationship are not gay. These are married men. Yeah. They are doing it because they don't identify themselves as gay. It's just a sexual act, an edge that they are trying to satisfy at that moment. And if these people that they are sleeping with do not have the information to access appropriate healthcare services, so you are bringing the disease back to the society. You're bringing the disease back to these people that are innocently not aware of an activity being done by the individual that's bringing it to the house. So you need to narrow the gap around that to protect everybody at the end of the day.
Where do female inmates feature in this thing? Because I'm sure they also do their things among each other there in jail. Is the risk lower among them in the nature of their indulgences, or is there something specific also that must be done for them?
The risk is, in terms of general, the risk is lower in terms of infection. But like we are saying, these things are intersected. You get a female person, let's say this person was a female sex worker, might get into the prison cell infected already. And if she is engaged in any sexual activity with another person, whether it's mouth to vagina or whatever it is, that they are doing there, so the risk of getting the other person infected is high. So it doesn't necessarily have to be lesbian individual. It can be a female sex worker who is incarcerated, and as a result of the activity that they are indulging in, so the other person is at risk also.
Absolutely. Agapitus, thank you for making time. I appreciate it.
Thank you, Trace.
Yeah, wonderful. That is Agapitus Hausiku. He is director of OurRight Namibia, weighing in on the debate around the distribution of condoms in Namibian prisons. Thank you for watching.
Thank you.